Well, hello, everybody. Hello. We have one of the best resources here to share information with you today. And this resource is one that is for older adults to provide you with a better understanding of what they do and also to answer questions for you. So today we have Abigail with ADRC, and she's here to share all the information that you need to know from one of the best resources here in Dane County. So please welcome Abigail.
Well, thank you very much, Janice. I also have to say you have a great resource right here as well. She did a wonderful job coordinating and keeping me informed. Also, the Fitchburg Senior Center. This is such a great wealth of information. We often refer to them for resources that are just specific for the Fitchburg area. So I know I'm going to be here to talk about the ADRC and toot my own horn, but also just really wanted to give out props to that as well. Anyone raise a hand have heard of the ADRC? Have you, anyone ever been to it or worked with them? Okay, has anyone ever talked to an ADRC in a different county, maybe for a loved one or someone else? No, okay, all right. Okay, so what is an ADRC? An ADRC really is a resource center for older adults, adults with physical disabilities, young adults, 17 and a half, aging into adulthood. And this could be for resources for chronic, long-term concerns or also short-term health issues that are happening. Our goal is to really empower the individual, calling us if you have questions for yourself, so that you can go on and be as independent and as yourself can be. So, and just like I said, ADRCs are located in all counties in Wisconsin. Who we serve: older adults, chronic health conditions, developmental disabilities, physical disabilities, family members, caregivers, often resources as well for professionals just wondering what might be out in the community. We don't have any income requirements, so anyone is able to call us. And doesn't matter your income, your assets. If you even are calling from another county or you're wondering about resources in a different county, individuals will call all different kind of ADRCs for that too. Some of the features. So we really try to be that friendly county face, if that makes sense. If you've ever been to our office, we are right there on the first floor, between a Family Dollar and a Goodwill. So you can walk in. We have resources all along the walls. There would be someone available to meet with you and talk to you. When you call, there is in the phone tree, someone like myself would be answering the phone to talk through about what your questions are. Again, we really try to have a comprehensive database. If you ever were thinking or wondering about help in the home, as you can imagine, if you look on different websites or talk to friends, there is just tons of resources out there. So we really try to help you with narrowing it down, giving you information that would be a bit more personalized. So again, providing information and assistance. So some examples would be individuals calling. Again, maybe they don't know about the Fitchburg Senior Center. They're not from this area, right? So maybe they are calling, wondering about home-delivered meals, or I'm needing a bath chair. We try to process through with them. This is a resource that you're needing, talking about your insurance, if that would provide any coverage for it. Or is there a loan closet somewhere that you can borrow one? Or is there somewhere that you can buy it? So really trying to talk through what some options might be available to you with it. Again, this also can range to where individuals are calling who have more serious help that they're needing in the home. Multiple things they're needing in the home. Maybe needing someone to come out to help with preparing meals, in addition to someone coming out to help cleaning, or also help with medication monitoring. So talking through some of these different options that might be available in the community. Often with that, we will then connect you to the resource. For some individuals, it's giving you the phone number over the phone, and then you're able to go make those phone calls on your own. For others, it can be more involved, where maybe we're needing to make those phone calls with you. Maybe we're mailing it out to you or emailing it to you and then following up to see if you had any luck with the resources we sent to you. The long-term care options counseling is somewhat what I talked a little bit about, but this would be talking with individuals who maybe are needing some more help in the home, or maybe they are thinking about downsizing, or they've been living at more of an assisted living for a couple of years and needing to talk to somebody about their finances and long-term care, kind of planning of how this works. And so with that, we really would sit and chat with people about what is your goal, what are you hoping to remain in your home, to maybe downsize into more of senior housing, and talking about those resources, helping you kind of come up with that plan of who would I call if I started needing hands-on help, or if I started being nervous and needing someone there with some bathing assistance. So you would know what's out in the community available to you to help make the best choice for yourself. And with that, it's great to call early, get a plan in place about what's going on with your health, just so if anything does pop up, you don't want it to turn out to be a crisis, or in the moment you need to figure something out. With the publicly funded long-term care, so this would be more thinking about if you're needing help in the home, and we've already chatted about maybe you have called some places and you realize I'm needing some help, but I can't afford it. What's out there? What is there to help? And so that then is where we can also help in the eligibility determination, and where you go to see if you'd be eligible to get some publicly funded assistance to help pay for those resources. Then with this, our additional services, this also kind of talks about what else is going on at the ADRC. Again, access to public programs and benefits, so that can be too where people calling who maybe have questions about food share or the farmers market coupons, just wondering about where to go to get those resources. We have a dementia care specialist, nursing home relocation, short-term case coordination, and just kind of trying to connect individuals with the resources that might be available. The caregiver supports. So with this, it again is where our office would be able to connect you to the resources who can help to determine if you're eligible for a possible grant, and then be able to receive the grant. So there are different caregiver grants out there for people who are stressed caregiver and needing some assistance for their loved ones, because there can be so much involved in caregiving. And again, Dane County has a wealth of resources. So reaching out, wondering what might be out there that you could, again, be eligible for to help care for your loved one. So this kind of talks about that, and often individuals, you might not know what's out there, so why not call just to help see if there could be something. Then this kind of talks a little bit about the grants themselves too, and I just wanted to highlight it because, again, when I come out, I don't know your situation, who you might be helping care for, or maybe you have a loved one who's helping you right now. So the National Family Caregiver Support Program is one for family caregivers who are, so it's kind of a double. So caregiving support for family caregivers 18 or older, caring for someone 60 and over, or someone with dementia, or grandparents and older relatives who are primary caregivers for minor children. It's kind of both. Then the Alzheimer's and Family Caregiver Support Program is one if you are caregiving for an individual who has dementia, Alzheimer's, or some form of diagnosed memory loss. And that would be another grant that then could help to provide help in the home, pay for respite care, maybe pay for different adaptive equipment. And again, I'm not going to go into it, but they kind of all have their own eligibility, their own little guidelines with it as well. And we also have dementia care specialists. The dementia care specialists, we have to right now manage the Alzheimer's and dementia grant. They also help with training different organizations and businesses in the area to be dementia friendly. They also meet with families who and individuals who maybe are having questions specific to dementia, be it maybe an individual is having some concerns around the home or behaviors, and trying to strategize plans with them, with the family, or maybe wondering about, again, resources in the community, wanting to know, is there memory care nearby? I know I have it linked here to our website, but what that opens up to is just dementia-related information. They also do free memory screenings for individuals. This could be in individuals' homes. They do them at events as well, too, where they're offering them where you're able to go and sign up to have a free memory screen. And again, sometimes with that, you go into the doctor's office and you can definitely have memory screenings there as well by the professionals. They aren't diagnosing, but it's really just out in the community if you ever had concerns with your memory. We also have benefit specialists. And these would be individuals specifically trained and supervised by attorneys who, if you are having trouble with your insurance or Medicare, denying something, and or if you've ever gotten like a letter from the Social Security office about like an overpayment or who knows, right? There's just so many different things out there. And you've maybe already tried to resolve it. Maybe you've talked to the wonderful case managers here as well for some guidance with it. The benefit specialists would be ones who, when you call, we kind of determine if we can make a referral to them and if they would be able to assist. They're wonderful at helping resolve some of those more detailed specific things and or working with Social Security, Medicare, some of those larger entities that can really be overwhelming when you're trying to advocate for yourself. So I wasn't sure if anyone, and I'm sorry, I should have asked if anyone had any questions as I was going along. Yep, that's all right. So she asked a question I'm not going to be able to answer, of course. It's kind of wondering, right, where all the uncertainty of what's going on right now with all the different cuts that are coming and then going to be appealed. And so we're exactly at the same page you are. We don't know anything more than what you guys hear in the news as well. So I wouldn't know any kind of cuts or any information like that. We more are, because you're not alone with calling or asking about it, right? Even for us personally. So often we're encouraging people to talk to their legislator, because I know, but it's your representatives, it's sending letters, it's letting it be known, because I think so much of that too is just a lot of uncertainty and changing daily. If you do have a loved one, the general services are the same, but we're all county specific, right? Same with like your Fitchburg Senior Center, like they're gonna know exactly kind of what's going on in your area. And so if you do have a loved one in a different county, I'm wondering about specific resources for that individual, they'd be the ones to call. But if you can't find the number, you can always call us too. Yeah. What would be like one of the most common questions that we get from individuals? And I would say, specific to everybody, we get a lot of questions about housing. And I know for us, of course, we're not the housing experts. So often with that, we're able just to connecting you to the right agency about senior housing. But often with that, it is unfortunately really difficult. Dane County is super hard with housing. Often it's applying and getting onto lists for the different apartments. Another big question that we get is our long-term care. So this would be individuals needing help in the home, wondering if they might qualify for public funding to help pay for assistance. As you can imagine, I'm not sure if anyone here does get any help in the home, but it can be a little bit jarring to hear, having someone come out to your home, maybe because, again, you're running meal prep. Maybe you need some help with someone to be there, hands-on assistance with like some bathing, and we can be talking, right, $50 to $90 an hour, and maybe they have a minimum of coming 3 hours, So that would be another big one, is people just, either they need help right now to pay for things, or they're wanting to plan. They're wanting to kind of think about, again, their income and their assets, and what is my plan with if I do need help in the home, because unfortunately as we age, things change, and we most likely might need some assistance from support, loved ones, extra help. And that's why when individuals do call, so she wonders kind of more specifically about that help for that long-term care. And I will say when individuals call wondering about help, we talk about how there's private pay help you can pay for, or there's the grants, or these publicly funded. And publicly funded is really limited. It's limited by two things. One, being eligible for Medicaid. And so this is the state of Wisconsin health insurance that's based on your income and your assets. And so often for an individual, your assets have to be down to around $2,000. So that's like, that's thinking about life insurance policies, that's thinking about checking, stocks, and savings. Then the other is the health-wise, what kind of help you're needing in the home. As I know, for a lot of individuals needing help with cleaning, and getting back to Janice's question, that's a big one too. People needing some help with chores around the home. That's another very difficult one to answer. But so again, for the publicly funded though, it is very limited because of your eligibility for Medicaid. So when individuals call, and maybe they are calling wondering about, let's say, like adaptive equipment, that would be one where often we would talk to them about the different resources, but then also encourage them to call their local senior center as well, who maybe has a loan closet. Another would be if an individual is calling and they maybe are having multiple questions and needs. Maybe they're noticing that they are wanting home delivered meals because they know that they are, they were recently hospitalized and back home, and they are also wondering about getting help in, maybe not help in the home, but maybe some help in the home with some chores, and questions about an application that they need to fill out. So kind of multiple things is often then when we would be referring them over to the local focal points. That makes sense. And then I would say for the senior centers, I think if they're working with individuals who they're noticing maybe needs more help in the home, that would be, I think, also when the local senior centers would be giving us a call as well, or maybe us for the dementia care specialist, noticing individuals or family caregivers who are working with someone who has some memory loss, some dementia, and they're having questions about how to best support their loved one in the home. We have like information about different support groups on our website as well. Some of those support groups are at the ADRC. They also, I know, have some different, like I said, kind of some of those memory screens. They also put on their own events. They recently did one about power of attorneys paperwork. So they have some. Our newsletter would have all of our information, but also their information specific, because they themselves don't have their own newsletter or anything. And with that, if you did want to sign up for our newsletter, it would just be best probably just to give us a call. We can get your email address or your mailing address or however you'd want to receive it. So we definitely get calls in regards to individuals who are homeless and aging. And so again, it's trying to talk to them to make sure, are they connected with the homeless consortium, because they do have like a listing that they work with individuals so that they can prioritize people. And also, same thing where if an individual is calling who has housing insecurity, we still talk about all the publicly funded programs, help them to see if they might be eligible for something. But you're right, for that, unfortunately, there are shelters and there is the homeless consortium. There is not any specific emergency. Those are the emergency housing options that are out there for individuals. And then with food insecurities, that's another one where when people call, we do this public benefit check where we just try to see what they might be eligible for to help with resources. Because again, there are definitely areas that don't have resources, and so trying to make sure if they are aware of any food pantries in the area, could they be eligible for food share? Do they know about the farmer market coupons? So it's really just trying to help connect individuals. Does that answer your question? Okay. So we try to be these generalists who have a lot of different information, and if we can't answer your question, then often it's, let me get your information and call you back. Because we can try and, search, see what might be out there. I think it's very difficult when sometimes there isn't questions about what's going on with the funding or what Janice brought up, right? Food, housing, some of these I don't have the great answers. I have some of these resources that are out there and we can try to help connect you to them. Sometimes we can't find that resource. Maybe one would be someone who maybe is wanting help with cleaning. And that is a hard resource, because there isn't a list of volunteers. So it is sometimes going through our options, having them call those options, see if they're eligible, and if they aren't, you're right, sometimes then I have to say that I don't have a resource for you right now, and it'd be something that we have to see if down the road there would be one, or how else can we brainstorm. So at times I don't have an answer, because there isn't always something out there. We try to brainstorm with you about calling different places, be it like calling the Fitchburg Senior Center to see if they have ideas. Like with the cleaning, be calling, do they have any resource or person that they know about? If you live in an apartment complex, can you put a sign up? It's just trying to really brainstorm what might be out there. All right, well, I don't know if there were any further questions. I again brought up the newsletter, the File of Life, and some brochures up here as well if you have anything further. Thank you very much for having me. Thank you, Janice. Thank you.